It's a very exciting time in really all of pediatric cardiovascular disease. We have echocardiographers who are making prenatal diagnoses of not only congenital cardiac defects, but also electrophysiology type disorders like complete heart block and other types of arrhythmias. From a surgical standpoint, we've taken on really operating on some of our very smallest patients who we call micro-preemies, and these are babies who are born who may be just around 1 kilogram or even less. That's just about 2 or just over 2 pounds, and we're completing their full repairs. And that's something that very few institutions are doing across the country. Additionally, in some of the more routine operations that we typically do, our approach has really been to do these procedures through what we call a mini sternotomy, and that would be an incision that's somewhere between 3.5 and 5 centimeters long, or up to about 2 inches long. And so the recovery time from these operations appears to be a lot quicker. The stability of the chest for these patients who are usually quite active is a lot more advanced than what we've seen in the past. Other types of heart defects we're actually repairing through the use of a thoracoscope, so keyhole type surgery, and we've just obtained a surgical robot, so we're going to be beginning some of our surgical repairs with the assistance of that robot. We treat a wide variety of very complex congenital heart disease here, and we tend to see some very complex lesions. For instance, in hypoplastic left heart syndrome, when we have patients who are not candidates for a full surgical repair early on, we've actually performed what we call a hybrid Norwood procedure, which is a take on the usual Norwood operation that these patients typically would undergo. In fact, our perfusionists here at Children's Medical Center in Dallas are most well known for the fact that they use the smallest heart-lung bypass machine so that we can really minimize the use of blood products in our patients in the operating room and also afterwards when they're in the ICU recovering. We have a very active ventricular assist device program, and that's really for patients of all ages. It used to be that only the older children or young adults would be candidates for this type of a device, but now we have started to use the Berlin Heart on a compassionate use basis, as it's one of those devices that's not yet approved by the FDA. But this is a device that we can use in patients who are even as small as about 3 kilograms, or just about 6.5 to 7 pounds. So that has been terrific. As far as heart transplantation, we certainly have experienced a growth in the numbers of patients who are candidates for heart transplantation, and we've got a very active program here. We are quite aggressive about getting those patients listed as quickly as possible so that we can help them out. I think on a very personal level, there have been my own motivations for even going into this field, and I have a younger brother who has congenital heart disease and was operated on when he was a young boy, back at a time where I know that my parents were quoted a very high mortality for the operation that he had. Now we do that same repair when babies are newborns, and the mortality is dramatically decreased, and really without people's passion for moving the field forward, I don't know that we would be able to have those tremendous statistics that we see today. We have certainly seen improved outcomes over the years, and now not only are we looking at the overall survival of our patients, but we're starting to look at things like quality of life, and that's becoming a more and more important factor as time goes on. We certainly have a number of more complex lesions that we're dealing with. We've got ongoing research that's really making our care the best that it can be for these patients, and I'm optimistic with the growth of our center and our new tower that's under construction right now, as well as the many research projects that are ongoing, that we're going to continue to be one of the leaders in pediatric cardiovascular disease.